This video will cover respiratory therapy oxygen modalities. We're going to start with our low flow systems. What that means is that the flow rate that's provided by the device is less than the patient's inspiratory flow. So the FiO2 will vary depending on the patient's rate and effort. The most common one that you'll see is the low flow nasal cannula. These delivery flow rates should be limited to no more than 2 liters per minute to avoid the possibility of creating an inadvertent CPAP. Anything over 2 liters a minute will need a doctor's order or be changed over to a high flow nasal cannula, which we'll discuss in another video. The FiO2 delivery that can be delivered by this device is up to 40%, but it is dependent on the patient's effort. Humidification is provided by a bubble humidifier that screws onto the flow meter. As is being demonstrated by my colleague. FiO2 adjustments are done by manipulating the flow at the flow meter. But again, these devices are not designed for any flow higher than 2 liters per minute. The rest of the oxygen devices that are provided here in our hospital are what we call high flow systems. These systems require a prescribed oxygen percentage that's delivered at flow rates that may meet or exceed the patient's inspiratory flow rate, so there's less variability in the FiO2. One of the lesser common examples is the Venturi mask, which includes a dial that you use to adjust for your desired flow rate and FiO2. The flow rate is provided by an oxygen flow meter and can deliver an FiO2 between 28 and 60%. It does not attach to any humidification. If you'll note, covering the dial device is a cap that is to prevent any blankets or anything from covering up those windows, which would increase the patient's FiO2 and decrease their flow rate. One of the more common high flow aerosol devices that you'll see here are what we call the trach collars or humidified aerosol masks. The liter flow on these devices is dependent on what your desired FiO2 is. It can deliver between 21 and 100%. It will deliver 21% when it is attached to an airflow meter. And in that particular case, it does not matter what the dial is set to, it will deliver 21% no matter what. If it is attached to an oxygen flow meter, as my colleague has demonstrated, it will deliver between 28 and 100% depending on what the dial is pointed to and what flow rate is dialed in on the flow meter. On the side of our water bottles is a chart that tells you what the desired flow rate is for a specific FiO2. The humidification is provided by the aerosol bottle itself. Next up, we have our reservoir systems. On these, the FiO2 varies, but dilution with room air is reduced because the patient has a reservoir to draw from. The first is the simple mask. Your liter flow on your simple mask should always be greater than 5 liters to avoid CO2 rebreathing. A liter flow less than 5 meters does not wash out the CO2 that's exhaled into the mask. Your FiO2 that's delivered by this device is between 35 to 50% and is dependent on the fit of the mask and the patient's work of breathing. It also does not provide any humidification. Our final device is our non-rebreather masks. These devices should be run at a minimum of 10 liters of flow. But the flow can be adjusted and should be adjusted to make sure that the reservoir bag stays at least 1/3 to half inflated during the patient's inspiration. The FiO2 delivered by this device is between 60 to 80%. Again, patient and mask fit dependent. It also is not humidified. Most of these devices, when it comes to troubleshooting, you just want to make sure that your oxygen tubing is plugged in and is not kinked. You want to make sure that it is on an oxygen flow meter and not an air flow meter. When to call your RT? Well, anytime a change is made to your flow or FiO2, an informative call to your assigned respiratory therapist is appreciated. Your RT should be called and will immediately come to the bedside if your patient is needing to be bagged. You've provided initial troubleshooting and the issue is not resolving. If the patient is deteriorating in status or their vital signs. And if the patient's tracheostomy tube has come out and must be replaced. This concludes our oxygen delivery device video.